the next slide I have, in the packets here in the room, we have printouts of this document, and we have links on our materials page online. Understanding the Behavioral Health Services Act, myths versus reality. And it's a long document, but I know a lot of you read long documents. You're given them anyway, I'm sure. I had, I've kind of gone through it, but not in detail. And what I'd like to do is kind of summarize it and pull out some of the points for you. But just wanted to, make sure you're aware of this document. It was put together by the California Department of Healthcare Services. And the areas that they focused on were funding, provider and system capacity, stakeholder engagement, and behavioral health services. So all those categories, I think what happened over time was leading up to Proposition 1, there was a lot of advocacy, and there was a lot of change also to the legislation before SB 326 was passed that allowed Proposition 1 to go on the ballot. So I think understanding where we're at in terms of what really is the reality of the Behavioral Health Services Act requirements and some of the allowances as well is important, and making sure we understand, what are really the rules, because I think there still are a lot of advocates locally and statewide that are concerned about certain parts, but some of that is addressed. But we need to make sure that we're aware of that and, continue to ask for what you want, make your recommendations, whether, the structure, it's regardless of what the counties are trying to do in terms of, just jumping through the hoops in order to figure out their funding mechanisms and how to allocate funding for the programs. You need to be spotlighting things, just like, was just shared from San Mateo County that if we keep bringing up an issue, that's when it becomes a priority for the department. So just wanted to make sure, more aware, and figured some of you would probably like this reading. I'll try to do a summary piece sometime soon. And then on our website, we have a lot of Behavioral Health Services Act tools. We have trainings and we have resources. So just kind of check your understanding, kind of 15-minute modules that allow you to just review the information. We have, a little bit of reading and then questions just to make sure you understood what you read, and doesn't take too long. One is on community planning, and then the other one is on funding categories. And then we have presentations. I will be going through the community planning presentation during the training tomorrow. But it's available online, and hopefully I'll get a good recording tomorrow and we'll be able to add that to our website. We also have unconscious bias training, and we have a recording and materials for that are really important, I think, to share both for your commissions and boards, but also for staff. And then requirements, we have just, the short lists of what the requirements are for the counties. The staff does the heavy lift in this area, but it's good for you to be aware of what the requirements are that they should be meeting, because you're there to ensure that it happens. They should be providing you information on their planning processes, and you should be ensuring that all of the different 29 stakeholder groups are actually involved in a meaningful way. Whether the department's able to put all of their needs into, the next behavioral health services integrated plan or not, over time, if we're engaging with people, they will become priorities. And if it becomes something that your board or commission hears about and decides that you want to make a recommendation on, it even gets even more emphasized for the county, and hopefully you know, in the future. Maybe it's not going to be, you know, this year or next year, but sometime in the future, you'll start getting these programs in place. And then resources, we have a listening session toolkit and a list of tools that Department of Healthcare Services has put together on different ways to engage people in the planning process. It could be surveys, it could be big public forums, it could be one-on-one interviews. They have a list, I think, maybe of 20 different ways to be engaging the different 29 stakeholder categories in the conversations around the integrated plans. And then the listening session toolkit is something that we put together as an example of what to do for a meaningful listening session, you know, what to do not only during the listening session, but before it, you know, to create those relationships and get that buy-in from whatever community group it is or organization, and maybe even have their own people or their own leadership help run the listening group session so that you have more of a partnership in that. That could be something that the counties are using. It could be something your boards and commissions are using. If you have maybe an ad hoc committee that's really focused on some type of research, trying to understand an issue so you can make a recommendation, you might want to run some listening sessions. You might choose some different groups that you want to talk to and get their input.